So you have a sore back. Well, welcome to about 80% of the people. Most people have some level of discomfort in their back. Let it be a sharp pain or a general stiffness. So if you just Google lower back pain, there are some questions that show up. What can I do to relieve my lower back pain? How do I know if my back pain is serious? There are so many things going on in the lower back area that it's very hard to pinpoint exactly what causes problems. You need to open up all possibilities. You need to work on your psyche, you need to work on your body. You want to make sure that you look at energetically what's going on with your body. That there are many solutions that are available. Step number one, you have got to commit behind figuring it out and get excited about it. The body doesn't work as isolated segments. The body works as a unit. There are kinetic chains that work together. If you experience stiffness in certain part of your body, that usually means that that segment of your body is working too much. It's used too much. Therefore, it will stiffen up because it's just overused. Segments that work together with that area work less. For this episode, let's examine how your lower back, your butt, and your hamstring work together. Here are the basics about the lower back discomfort. The lower back muscle, your butt, and the hamstring, they always work together. There's actually other participants in this chain, but let's just talk about these three components: the lower back, the butt, and the hamstring. If one of these three doesn't work, then the other two has to work harder. Indeed, the gluteus maximus, the big butt muscle, the largest muscle in the body, the most dominant muscle around your pelvic and your lower back area, if that doesn't work efficiently, your hamstring and your lower back will have to work harder and more. When you're sitting down, you're utilizing and you're using your hips and your lower back region in a way that it was not designed. When you sit on the ground, you realize you need to switch your position into this. And you can sit like this for 2 minutes and then your body is like, okay, I want to switch again. There's a continuous switching if you sit on the ground. When you sit down in a chair, you're sitting on your gluteus maximus. You're squeezing the blood out of it and you're stretching the fascia over top, the muscle. So you're making it dysfunctional. And when you do that for a decade, 2 decades, 3 decades, it's just gonna distort your body. For many people, their butt muscle, the gluteus maximus, doesn't really work properly. At the same time, your lower back and your hamstring are still working because you're still trying to get from A to B. And when you're trying to move your body from A to B, you're using your legs to move you forward. But if one section doesn't work, then other sections need to work a little bit harder. Every step you make with a dysfunctional butt will stiffen up your hamstring, stiffen up your lower back. So making the butt more functional will take away tension from your lower back. So we want to make sure that the butt works harder. We also want to make sure we stretch out the hamstring, stretch out the lower back effectively. Lower back discomfort is a complicated subject. Some of them you can address on your own, and some of them it might require a little bit more specific knowledge to unravel. Look at pain as a guide. Just like when you put your hand towards the fire and the fire starts to burn your hand, your body tells you in the form of pain to pull it away. Your lifestyle led to pain, a discomfort of your lower back. So the pain is just telling you that the direction you're headed is the wrong direction when it comes to a harmonious way of existence. So you need to go towards another direction. What direction exactly? Well, that is the journey. That's what you want to figure out. Sometimes there's more to the story. Sometimes you do need a specialist to help you with it, because if some sort of joint degenerations took place in your lower back or your hip area, you might need to use more specific tools. When it comes to serious lower back pain, consult a specialist who has a good track record of helping people resolve their problems without medication. Because oftentimes when you use an injection, you use medication, that just numbs the pain. Oftentimes that does not address the underlying problems, what caused the pain in the first place. Getting an injection will make it go away. Yes, true. But structurally, whatever caused the pain was not addressed. It's only a matter of time before that pain will come back again. Get to the bottom of a problem and figure it out and build up capabilities based on the weakness, balance it out, and create a more harmonious life.